Medicare is really customizable and it can be changed throughout the aging process, which is what I love about it. So
Right.
if you're overwhelmed by all the mail, all the advertising you see on TV, enlist the help of a broker.
Hi, I'm Rebecca Donze, Senior Care Advisor with Senior Living Experts. And today I'm joined by Robin Dawson from Medicare Solutions Network. Thank you, Robin, for joining me today. I think we'll start by you just telling a little bit about what you do and a little bit about yourself.
Yeah, so I'm an independent health insurance broker. I help people navigate the world of Medicare, make plan selections, and I also help with enrollment at no fee.
Absolutely. And I know this would be a good topic for this time of year. There's a lot of talk right now about Medicare.
Yes.
And I think it's because it's the Medicare annual enrollment time.
It
So,
is my favorite time of year.
absolutely. So why don't you tell us a little bit about Medicare annual enrollment period and what people can do during this time?
So the annual enrollment runs between October 15th and December 7th of every year. And this is a period for people really who are already enrolled in Medicare who want to make changes to their coverage. So for example, people enrolled in original Medicare Part A and B that might have a Medicare Advantage plan, they can switch from a Medicare Advantage plan back to original Medicare. And they can also sign up for Part D prescription drug coverage during this time. They can also change from one Medicare Advantage plan to another. For people who might be enrolled in a Medicare Part D prescription drug plan, they can make a change from one Part D plan to another. They can also cancel their coverage if they need to or want to. Or if they don't have Part D, they can sign up for Part D at this time of year. The other thing is if someone is enrolling during this time, it's important to note that the changes that they make during this period, the annual enrollment, they're not going to go into effect until January 1st of the following year. This also isn't a time for people who maybe missed their other enrollment opportunities to enroll in original Medicare A and B. Those folks have to wait until the open enrollment period that starts January 1st and runs through March 31st of a calendar year. Then the last thing that people can do is if they want to change or apply for a different Medicare supplement, if they're in original Medicare and have a supplement during this time, they're still going to need to answer questions about their health when they do so, unless this period coincides with their individual open enrollment for a Medicare supplement. A lot of times people are confused and think that this time of year is a time where they can enroll in a supplement and not be asked health questions. But that period only exists if it coincides with their open enrollment when they first come to Medicare.
Tell me, if someone is turning 65 in the coming months, what do they need to know before they sign up for Medicare?
Well, there's a couple of things. First of all, they definitely need to know when to enroll. Each person has an initial enrollment period that begins 3 months before the month they turn 65 and lasts for 3 months after their birthday. So outside of that window, there are a number of other circumstances that would qualify someone for a special enrollment period to come to Medicare at a later date. But missing an enrollment deadline can mean having to pay financial penalties for late enrollment or maybe even having gaps in coverage. So you definitely want to know when to enroll. The second thing is I tell people to learn what is covered under original Medicare Part A and B, and also what's not covered. There's a lot of great government resources out there. I do a lot of webinars throughout the year that help people understand these benefits, but original Medicare was never designed to cover 100% of your medical costs. There's co-pays, deductibles, and co-insurance amounts that you are responsible for. So it's important to know what it does and doesn't cover. The third thing is to learn the difference between Medicare Advantage plans and parts, which is considered Part C, and Medicare supplements that are also called Medigap plans. There's a lot of confusion in this space, and I would just explain it very simply in saying that Advantage is an alternative to Medicare, while a Medicare supplement helps people pay for costs not covered under original Medicare. So these plans are significantly different in how they work and how you pay for health care while you have them. And then the very last thing is find out what prescription drug coverage will be best for you. Not all of these plans are the same. There's a lot of options for sure, but they're not all the same. They cover different medications. This is called the plan's formulary. And they each also have different preferred pharmacy partners. So making sure you pick a plan that covers your specific medications and filling those medications at a preferred retailer or mail order partner will be the most cost-effective option for you.
Medicare Part D covers the prescription drugs, but what if a person doesn't take any prescription medication? Can they skip getting Medicare Part D and do it at a later time, or should they sign up for it right away?
Yeah, that's a great question. I get this a lot because a lot of people aren't on prescription medications when they first come to Medicare. So
Right.
the thing that you need to know is if you put off enrolling in Medicare Part D for 63 days or more after your initial enrollment in Medicare, and you don't have other creditable prescription drug coverage, like coverage that's built into an employer group plan or something like that, you may be subject to a late enrollment penalty. And the cost of that penalty will really depend on how long you go without coverage. So what Medicare does is they calculate the penalty by multiplying 1% of the national base premium for Medicare Part D in a calendar year. And they multiply that times the number of full uncovered months that you didn't have Part D where you could have had Part D. And so you really want to get a plan because once you step off of other coverage, within 63 days, that penalty will start silently calculating in the background. But equally important to trying to avoid a penalty, the reason I tell people to get Part D when they're first eligible, even if they're not on a lot of medications, is because you can't just add it at any time if you come to need it. So without a qualifying enrollment reason, you'd have to wait until this time of year, the annual enrollment period between October 15th to December 7th to jump into a plan, and then those benefits won't start till January 1st of the following year.
Very good to know. And there's so much TV advertisement and mail this time of year about Medicare. What is your advice for people who are confused about what to do?
Well, I would say take a deep breath first, okay?
Yeah.
And then ask yourself a few questions. How is your current coverage working for you? Do you feel it presents a good value for what you're paying? Another thing is, has anything changed with either your doctors or your prescriptions? How's your current health? Are there any new considerations or healthcare needs now that you didn't have previously when you picked your coverage initially? Medicare is really customizable and it can be changed throughout the aging process, which is what I love about it. So
Right.
if you're overwhelmed by all the mail, all the advertising you see on TV, enlist the help of a broker to work things through. I happen to know somebody. She looks a lot like me.
Thank you so much, Robin, for
Welcome.
coming on today and answering these hard questions that seniors and their families often encounter this time of year and all throughout the years.
Thank you for having me.
You're welcome. And we will be posting your information at the end of this as well. So
Wonderful. Thank you.